Cancer is often called the silent killer because there are few early signs or symptoms. But there are things you can do to help lower your risk, such as getting screened. Here to tell us more about colon cancer screening is Dr. Barakat, Altamimi with Mercy Gastroenterology Clinic. Doctor, thanks for joining us here today.
Thank you for having me.
And tell us, we hear a lot about colon cancer screening. What does that entail?
According to the Iowa Cancer Registry, Iowa ranks the 7th in regards of incidence of colorectal cancer. It is the third most common type of cancer nationwide. We do have a few tests to help us identify it in its early stages. That pans out from like FIT test, DNA test, also known as Cologuard, which also uses a combination of both, and flexible sigmoidoscopy, and the best of them all, a colonoscopy.
And for those who should get screened and when?
That's an excellent question. So according to the U.S. Preventive Services Task Force, any individual above the age of 45 should have a colon cancer screening done. There are certain individuals that are higher risk, some people who have family history, others who have certain genetic disorders, people who have received radiation to the pelvis and abdomen are at a higher risk and might have to start even earlier.
And for those who've never had a colonoscopy, can you explain how it works?
Sure. So it starts with a little bit of prepping. So there will be a few days.
There's some bad things about that, but yeah.
Yeah. So usually start with a little bit of a prep, a few days without having vegetables and fruits and nuts. This is usually followed by a purgative fluid. And after that, you would present over to the endo unit where they will get you into a room. They'll get an intravenous line in for you to get the sedation that you need. Then they wheel you into the endoscopy room where the scope happens. They'll put you into what we call as a twilight zone. So the sedation is not meant to completely make people sleep fully, but a lot of people do. Following that, we advance the scope from behind all the way to the beginning of the colon, known as the cecum. And as we withdraw, we find the polyps and we pluck them out. Then the patient is wheeled back into the recovery area, which usually takes about half an hour, and they're back to their usual business. A lot of people will say, when are we going to start? And we've already been done.
Maybe it's not that bad is what people have in their mind. Well, Dr. Altamimi, thanks so much for joining us here today.
No problem. Thank you very much for having me again.
And stay with TV9. We'll be right back.